welcome everybody. I'm here again to discuss about dentistry. I would like to give you the latest information regarding dentistry. I would like to introduce myself to you. My name is Ofelia Villanueva, a general dentist in Quincy, and I've been practicing for almost 18 years now. I graduated in Boston University, graduate of dentistry, that's in Boston. And also I graduated in the Philippines as a DMD. I am here to represent the voice of Academy of General Dentistry. Academy of General Dentistry is an organization, second largest organization in the United States of America. Academy or AGD speak about the general dentistry or general dentist. It increases the public awareness regarding dental benefits or dental health. Now, I would like to introduce you today our guest because we are talking about dental hygiene. So I invited a dental hygienist, and her name is Sue Salveggio. Hi, Sue. How are you?
Great, Dr. V. Nice to meet you.
Yeah, thank you so much for letting me to interview today. And I have some few questions, to ask you about dental hygiene. Sue is a dental hygienist, and she will tell you about her educational background and how long she's been practicing in Boston, right? Can you tell about the viewer about you, Sue?
Sure. I started out actually as a dental assistant in 1978, and then I went back to school for dental hygiene, and I graduated in 1991 from Tungus Community College in Connecticut. And I've worked in Connecticut, Virginia, Florida, and now Massachusetts. I've been in Massachusetts for just about 3 years now.
Oh, that's good. Sue, can you tell us, what is the training that is necessary to be a dental hygienist? Not all dental practices has a dental hygiene. What is your role in there in the dental practice?
There are a few different programs for dental hygienists. There's both associate degree programs and bachelor degree programs. The program that I went through was an associate degree program, 2-year program, and it involved many clinical hours and many subjects in science and dental sciences. And our role in the dental office is to prevent dental disease, such as decay and periodontal disease, by teaching our patients how to take care of their teeth and encouraging them to come in for their regular visits, just to maintain their health and to improve their dental health.
Some people, they don't know the difference between the dental assistant and the dental hygienist. Dental hygienists, they do clean the teeth, they give training, they give education,
yes,
right? And you tell and you do cleaning and measurement of the gums. You're allowed to do that, right?
Yes, we take assessments of the gum tissue, we polish the teeth, we remove the hard deposits, we give fluoride treatments, we do sealants, we do scaling and root planing, lots of education. We can assist the dentist if necessary. We can take dental impressions, whereas the dental assistant works directly with the dentist.
Like assisting only, but they cannot put their hand in the oral cavity?
Well, they can polish teeth.
Oh, they are allowed to.
They are allowed to polish teeth.
That's good.
They can take impressions. They can take x-rays. There are a lot of similarities, but yet there are many differences as well.
I would like to ask you how, what do you like most about being a dental hygienist? You have to have a passion to do that, to be really good in doing cleaning. I know some hygienists, they don't, so I know they clean good, but there's some differences.
Yes, I'm a people person and I love meeting new people. And in the course of a day, we meet several people and we establish a relationship. And I just love being able, at the end of the day, to have the satisfaction to know that I helped improve their not only their dental health, but their overall health.
Mm-hmm. What are some of the biggest challenges hygienists face?
Well, a challenge for me is when I've done my part in the operatory, teaching the patient how to take care of their teeth, leaving them with a squeaky clean teeth when they leave, and teaching them how to use their electric toothbrush and how to floss. And sometimes they fall away with their home care at home, and they might come back in 6 months and they haven't been flossing. Maybe they're not brushing twice a day, and that's a challenge. It's a little frustrating because
meaning they are not following what you are advising them to do.
Right, in some cases, because we are a team. And
okay. So you're talking about the patient, and you should have a teamwork.
Yes.
You know, in order to preserve the dental health, then they should follow you, and they be compliant.
Exactly.
Is that what you mean?
Exactly.
All right. So, how do you keep your adult patient comfortable during hygiene visit? If they have sensitive teeth, let's say you go there and then you cannot get in right away because they are very sensitive. What do you do?
Well, we have topical gel that we can put on the gum tissue called Oraquix, which is a lidocaine and prilocaine based gel, and it numbs the gum tissue. It only lasts for 20 minutes, so we can get the work done. They can be comfortable. They don't leave with feeling numb. They can eat right away. There's also another product called Colgate Pro Sensitivity, and it's a polish that we can polish on the teeth after a deep cleaning to prevent the teeth from being sensitive.
Is it the latest now? I heard about that. Being a general dentist also, I just applied it last week. You know, I don't know yet the outcome. That's why, you know, the Colgate said that it's 4 weeks. If they are very sensitive, they will be out of sensitivity.
Exactly. That's the newest product out. And
can they buy it over the counter, or the dentist should apply it?
The dentist has to apply it.
Or hygienist?
Or a hygienist, yes. And it cannot be bought over the counter. It is prescription strength.
Okay. You mentioned about the scaling and root planning. I would like to, you know, the viewers to understand the simple cleaning versus the deep cleaning, or we call the dental term is scaling and root planning. When I do my patient, I tell them deep cleaning. And the reason why I said deep, because I'm gonna do an injection. You know, do you do the injection, or the dentist should do that before you do the scaling and root planning?
For scaling and root planning, the patient, depending on how severe the periodontal disease is, how deep the pocket is, we have the option of using local anesthesia, which is used with a syringe, or we could use the topical gel, and which I could apply as a dental hygienist. And the periodontal scaling goes, as I said, deeper under the gum line to remove the heavy deposits. And a regular 6-month dental visit would be removing the tartar above the gum line, slightly beneath the gum line, polishing, do an oral cancer exam. So the differences are between how much tartar is on the teeth.
You said about, did you mention about the probing? Like before you do the deep cleaning, not all the patients, not all people needs a deep cleaning. Only those who have like measurement on the gums. Dentists measure the gums, and hygienists too, right?
Yes.
And then they will diagnose if you have a periodontal diseases.
That's correct.
Because gingivitis or gingival inflammation is different from periodontal diseases, right?
Yes. On every patient, every time, and every tooth, I take a measurement with a small gauge that measures in millimeters Ideally, the gum tissue, the space between the tooth and the gum, the depth of that should measure 3 millimeters or less. So we record these measurements, and anything that's 4 millimeters many times is gingivitis. It's an inflammation, and it can be reversed by removing the tartar buildup and maintaining a good oral health. But if we get into 5s or 6s for a measurement, in millimeters on your teeth, that is quite significant, or deeper than that. And then we need to numb the gum tissue with local anesthesia.
Who is putting the anesthesia? Is that you or the dentist will do that to the patient? Well, and before you answer that, you know, who is giving the diagnosis to the patient that they have a periodontal diseases? You measured, and then you tell the dentist, and the dentist will tell the patient?
We work as a team. I collect the data, but the diagnosis does come from the dentist.
Okay.
And at that point, we'll determine whether the patient would need quadrant root planing or just localized to specific teeth.
Yeah, you said quadrant, so meaning when the hygienists do the scaling and root planning, they cannot do it the overall mouth. They have to do it in sequencing, right?
Many times, yes.
Yeah. I would like to go back to the sealants, because you mentioned about that you are allowed to do sealants.
Yes.
Right? Sealants, would you mind to explain it to the,
sure,
you know, to the viewer, who, you know, sealants, whom is indicated to?
Sure. When permanent molars come in at around age 6 years old and also 12 years old, these teeth are permanent teeth. They need to last a lifetime. But the biting surface have deep grooves in them, and bacteria gets caught in those deep grooves. Even with the best toothbrush, bacteria gets caught in there and can cause tooth decay. So a sealant, what we do is we prepare the tooth, we polish it, we put a little etchant on it, rinse it off, and then we put a liquid, it's a type of plastic, on the teeth. We put a light on it. It's a very, very thin coat. We put a light on it which cures it, hardens it, and that prevents bacteria from lodging in those deep crevices, and it prevents tooth decay. So it's a wonderful procedure.
Yeah.
And
do you indicate that to all children, or there is like a specification, like deep groove, you know, like if it's not deep groove, do you have to put the sealants on?
Really, I leave that up to my dentist
to
determine, but
okay.
I would have to say that definitely deep grooves. There are some children that have very shallow, almost non-existent pits, and they'd be exempt, but the majority of the children do need them.
Yeah, especially those who have a history of a lot of cavities on their primary teeth.
Yes.
And then you recommend the sealants into the first molar. I heard also that premolars are also indicated for sealants now, and the insurance covers that too. Do you do the premolars also?
Yes, depending on how the crevices are, if they warrant a sealant, if they seem to be a deep enough groove. If it's very shallow, almost non-existent, then it's not necessary.
Yeah. Okay, I would like to ask you the toothbrushes. You know, there is a electric toothbrushes, and now there's a lot in the market now about the battery-operated toothbrushes. Is it harmful? There's a question that if I'm using that electric toothbrush, is it very harmful into my teeth that will abrade my teeth?
Well, electric toothbrushes are wonderful. I've seen the results in my patients before and after, and there's a tremendous difference in the amount of buildup that they have. There's many kinds on the market, and I personally like the type that sit on a charger.
Oh, so electric toothbrushes.
Right, but there's
Okay.
there's some that have batteries that you put in them, and I feel that they're not really as consistent with the
Okay.
cleaning as one that sits on a charger. And I also feel that you can be too aggressive with it as well. It's very important not to bear down too hard on the electric toothbrush while you're brushing. But it's a great tool. I really think everyone benefits from it.
Do you think it's really indicated to all patients to have that, or?
Well, it's not harmful.
Okay.
And some patients can clean their teeth. They can get all the plaque off no matter what they use. But I have seen a huge difference with people who are having a hard time maintaining their teeth and now use an electric toothbrush. They have far less tartar buildup.
Okay, my last question to you, Sue. Okay. I heard about what is a advanced dental hygiene practitioner. You know, there's a nurse practitioner, right? But about advanced hygiene practitioner.
Well, this is
What's the
brand
training
new.
involved?
This is brand new, and the first class has started fall of '09.
What school?
And this is at the Metropolitan State University in St. Paul, Minnesota. And the practitioners that graduate from this program will be able to practice in Minnesota. Right now, Connecticut Phones is considering starting a program, but is not initiated yet. And it's a master's program, and it's open to hygienists who have a bachelor's degree, and they would be able to, as you said, it's akin to a nurse practitioner. They would be able to do more than dental hygiene, and they would serve underserved populations.
Meaning they can open their own dental hygiene practice in Minnesota? Not in Massachusetts yet, right?
No.
Okay,
This is
all right.
just Minnesota, and it's brand new, and I think they still have to iron out the legalities of
The
it
legalities.
because
Okay.
it's so new.
Yeah, Sue, you help so much. You know, I hope the viewer find it helpful from Sue to explain to you the responsibility and duties of a dental hygienist in the dental practice. And it's an honor that Sue, you know, give us a day for us to interview her. And I thank you so much, and I hope I'll see you again on the
Thank you.
future.
I appreciate it. It was
Thank
very
you.
nice meeting
Yeah.
with you. I enjoyed
And
it.
thank you so much to the viewer, and have a nice day.
And brush and floss.
Did you mention?